Good afternoon, everybody. This is Dr. Hart, and I'm going to go over 7, I believe. These are NCLEX style test questions on anxiety and covers the priorities of those disorders. Anxiety, PTSD. I covered a lecture on that. Check out my YouTube channel. It's going to have some lecture material, some content, and also some practice questions that we go through. Okay, so I hope this helps. If you find it helps, please like and subscribe to my YouTube channel. I'm also on loading these up to TikTok as well. So I hope you're getting something out of it. Let me know in the comments. Great. Let's continue. Number 1. Okay, first one. The client is experiencing a severe panic attack. Which nursing intervention would meet this client's immediate need? Now, immediate need is the key words in this question. Always looking for that type of clue in the stem, the first part of the question. That's called the stem of the question. The answer choices, those are typically called the distractors. So in the stem of the question, which nursing intervention would meet this client's immediate need? This client is having a severe panic attack. Okay, so let's go over the answer choices, and then I'll go over which one is correct and why it's correct. Answer choice number 1, teach deep breathing relaxation exercises. Number 2, place the client in a Trendelenburg position. Number 3, stay with the client and offer reassurance of safety. And number 4, administer the ordered PRN buspirone. I haven't covered the psych meds yet, but I will. Okay, so pause this, and I'll give you a second to pause this and think about what you think might be the answer. Okay, we're back. Okay, so in this case, the correct answer is and I spoke about this in the lecture on anxiety and OCD disorders. I talked about this, what the priority is for a client who is having a panic attack. So the answer is number 3, stay with the client and offer reassurance of safety. So we're trying to think about the client's immediate need in this question. Okay, you're not going to leave the room. You're not going to go off and look for help. Okay, if your client is going through a panic attack, you are going to stay with the client. If there is any code, if there is any chest pain, anything that it's an emergency situation, you are, as a nurse, you should be staying in the room with the patient. You can always hit the call bell. You can call out for help. Trust me, people in the hall and down the hall are going to hear you. Okay, so let's go over these other choices, answer choices. Number 1 is teach deep breathing relaxation exercises. So do you think this is going to meet the client's immediate needs to teach? Okay, so if you're looking for immediate needs, patient education is probably not going to be an immediate need. Okay, this is not the time. your client is feeling like they're going to die. This is not the time to teach deep breathing. Okay? Number 2, place the client in a Trendelenburg position. What's Trendelenburg? Okay, that's like head up. Head down. So that position, bed position, is where you're changing the bed position so the head is down, and that's in the case of like a drop in blood pressure that would be used. Okay, so that's not for a panic attack. Number 4, administer the ordered PRN, buspirone or Buspar. I know I haven't covered the psych meds, but buspirone, just quickly, is a long-term medication. It's not like a short-term benzodiazepine. It's not a benzodiazepine. It's a long-term medication, and it's meant to be taken daily, not PRN. Okay, so those are your clues. In that case, you have to know what that medication is. And that's, like I said, that's one of them that I'll cover, is buspirone, or brand name Buspar. It's typically a daily medication to maintain anxiety. It's not a benzodiazepine. It's not addictive or habit forming. So it's a good medication to use, but not in the case of a severe panic attack, okay? So you want to stay with the client, offer reassurance of safety. Next one, a client is newly diagnosed with OCD and spends 45 minutes folding clothes and rearranging them in drawers. Which nursing intervention would best, next clue, okay, would best address this client's problem? Which intervention would best address this client's problem? So what a problem are they having? They have OCD, and they're engaging in ritualistic behavior. Okay, so let's go through those answer choices. Number 1, distract the client with other activities when ritual behaviors begin. Number 2, report the behavior to the psychiatrist to obtain an order for medication dosage increase. Number 3, lock the room to discourage ritualistic behavior. And number 4, discuss the anxiety-provoking triggers that precipitate the ritualistic behaviors. Okay, so I'll give you a minute and we'll come back and talk about the answers. Okay, we're back. All right, so on this one, the correct answer is number 4. The best nursing intervention for this client and the problem they're having with the ritualistic behaviors. And they may also do this in therapy. Number 4, discuss the anxiety-provoking triggers that precipitate the ritualistic behaviors. Okay? And so the nurse in this situation should discuss with the client what anxiety-provoking triggers would trigger them to engage in the ritualistic behavior. If the client is going to be able to avoid the anxiety, they must first learn to recognize precipitating factors, or what triggers are they having. Okay, let's go over the other answer choices. Number 1, distract the client with other activities whenever ritual behaviors begin. So I don't know how that would help to distract the client. They're always going to have anxiety, no matter how much you try to distract them. So the key is to help them discuss what their triggers are so they can identify those, okay? Number 2, report the behavior to the psychiatrist and get an order for a medication dosage increase. Okay, that's not always the first go-to medication. You may think it is, but this is not a situation where increasing the medication is going to help the client deal with their triggers and talk about what triggers their behaviors. Number 3, definitely not, you're not going to lock the room. You're not going to lock, I don't know what room they're talking about that you're going to lock, but you're definitely not going to lock the room to discourage the behavior. Okay, and let's go to the next one. Oh, this is select all that apply. So there are there is more than one. Most likely there is more than one answer choice. It doesn't mean there is. Select all that apply. I know they're difficult. They really are more difficult than the other answer types, the question types, NCLEX style question types. In some, there may be one answer choice. There may be 2, 3, 4, 5 answer choices. It doesn't always mean that there's more than one, so you have to be careful about that. You just have to go through, answer, look at each answer choice, and think to yourself, does this apply, and does this answer the stem of the question? Okay, so the nurse is discussing treatment options with a client whose life has been negatively impacted by claustrophobia. So if you don't know what claustrophobia is, you really don't have to know what it is to answer this question. It's a phobia, and it's a fear of closed spaces, like of elevators, for example. The nurse would expect which of the following behavioral therapies to be most commonly used in the treatment of phobias. So see, you don't even have to know what claustrophobia is. You're looking for the most commonly used treatments for phobias. Okay. Okay. Behavioral, the key word here too. Behavioral treatments. Think about the behavioral treatments. If you want to go back, listen to my lecture. I talked about all of the behavioral therapies. All right. Number 1, benzodiazepine therapy. Number 2, systematic desensitization. Number 3, imploding or flooding. 4, assertiveness training. And 5 is aversion therapy. All right. So I'll give you a second, and we'll come back and talk about these. Okay, we're back. All right, so in this one, I talked about these therapies for phobias. All right, the correct answers are number 2, systematic desensitization, and number 3, imploding, which is also called flooding. Okay, in systematic desensitization, the client is gradually exposed to the phobic stimulus, either in a real or imagined situation, and they are always with the therapist in a safe environment when they're doing this. The other correct answer, number 3, imploding therapy or flooding, is a therapeutic process where the client must imagine situations or participate in real-life situations that he or she finds extremely frightening for a prolonged period. And again, these are done with the therapist. For example, if the therapy is going to be treat a phobia of getting on an elevator, the therapist is going to go with them to the elevator and practice that over and over and over again until they become less sensitized. So that's the desensitization comes in there. They're exposed to the phobia, so then it doesn't feel so bad. I mean, it takes time, but those are the two behavioral treatment therapies. Okay, let's go over the other answer choices and talk about why they are not correct. Number 1, benzodiazepine therapy. There's a clue. Is that a behavioral therapy? No, that's a medication. Number 4, assertiveness training. No, assertiveness training is not used. Why do you need to be more assertive if you have anxiety and phobias? Okay, it's not used for anxiety and phobias, and neither is aversion therapy. Okay, so the answers on this one are 2 and 3. Next question. A client is prescribed alprazolam or Xanax, brand name Xanax for acute anxiety. Which client history should cause the nurse to question this order? So that means what client history would be contraindicated for the use of alprazolam? All right, so you have to know what alprazolam is, what kind of medication is it, what classification of medication is it. Answer choices: history of alcohol dependence, history of personality disorder, history of schizophrenia, or history of hypertension. All right, we'll give you a minute. We'll come back. Okay, we're back. All right, so which client history would be contraindicated with alprazolam? Okay, and I'm going to talk about in another lecture, I will talk about the psych meds, the ones that I lecture on. I'm also going to cover schizophrenia. I'm going to cover eating disorder. I think I already did cover eating disorders. I'm going to cover personality disorders. One of my favorites is personality disorders. I will also cover substance abuse, and alcohol dependence is one of those. Okay. So the correct answer on this one, which would be contraindicated when you are giving your client alprazolam. Okay, what is alprazolam? Brand name Xanax. That is a benzodiazepine. So number 1 is the correct answer. Any history of alcohol dependence would be contraindicated for giving your client alprazolam. Okay, alprazolam used for anxiety is a benzodiazepine used in the treatment of anxiety, has an increased risk for psychological dependence and tolerance. Clients with a history of substance abuse are more likely to abuse other addictive substances, or they may combine this drug with alcohol. Okay, so pretty much all psych meds, benzodiazepines should not be mixed with alcohol. Why? Because alprazolam is a depressant, neurocognitive depressant, and so is alcohol. Okay? So if you have a client with alcohol dependence, they should not be prescribed a benzodiazepine. Benzodiazepines are very addictive. They're likely to abuse these if they have a history of alcohol dependence. Okay, alcohol dependence indicates also a type of addiction. Addiction is covered in alcohol, and when I get to that chapter, I'll go into them. Alcohol, opioids, benzodiazepines, okay, stimulants. Any of those are not safe for anyone with addiction tendencies. Okay. Next one. The nurse is providing discharge teaching to a client taking a benzodiazepine. Okay, here we are again. Which client statement indicates a need for further instruction? A need for further instruction is in bold for a reason. So you're always, when you're answering these test questions, always having in the back of your mind safety, because this is what your NCLEX is going to be mainly based on, keeping your patient safe. They want to graduate safe nurses. They want to give safe nurses that license to practice. If the computer doesn't determine that you're safe, you will not pass. Okay, So a nurse is providing discharge teaching, so this is patient education, to a client taking a benzodiazepine. Which client statement, so this is something the client is saying, indicates a need for further instruction. So this is something that the client is saying that is going to contraindicate the use of a benzodiazepine. Okay, it's going to be something not so good that the client is saying that's going to be a red flag for when you are giving the client the benzodiazepine. Okay, number one, I will need scheduled blood work to monitor for toxic levels of this drug. Number two, I won't stop taking this medication abruptly because there could be serious complications. And number three, I will not drink alcohol while taking this medication. Number four, I won't take extra doses of this drug because I can become addicted. All right, so we'll pause for a second and come back and talk about these answer choices and which one is correct. Okay, let's come back and talk about this one. Okay, so need for further, which client statement indicates a need for further instructions? So this is something negative, something bad that the client says about a benzodiazepine, or something that's not correct. So you just taught them, you just did discharge teaching, you just taught them about benzodiazepines. What's something that's incorrect about benzodiazepines? Okay, and the correct answer is number one. I will need scheduled blood work to monitor for toxic levels of this drug. That is not correct. Okay, so this client statement about the need for blood work to monitor for toxic levels indicates a need for further instructions. Blood work is not necessary when taking a short-acting benzodiazepine. Now, when I covered bipolar disorder, what medication would require blood work? And that's the lithium that my patients with bipolar disorder are taking. Okay, but not a benzodiazepine, does not require blood work. Let's look at these other answer choices. Number one, number two, I'm sorry, I won't stop taking this medication abruptly because there could be serious complications. That's a correct statement. You got to teach your client not to stop the medication abruptly, especially a benzodiazepine. Okay, they can have, if they've been taking it for a long period of time, they can have seizures if they stop abruptly. Okay. Number three, I will not drink alcohol while taking this medication, and that is a correct statement. Your client should be taught they cannot drink alcohol while taking this medication. And number four, I won't take extra doses of this drug because I can become addicted. And that is also true, a true statement. So you're looking for the answer choice that is not a correct statement about a benzodiazepine. Okay, so I just want to say one thing. I'm going to give you one client experience when I had my students in the clinical setting. The nurse was giving discharge instructions about the patient's medications. The patient was, one of the medications the patient was going, prescriptions the patient was going home with was a benzodiazepine. So he had, I don't know, let's say he had 6 medications. It wasn't the only one. So the nurse went through all the medications, listed them, that the patient prescriptions that he was going to go home with. Blah, 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 blah. Benzodiazepine, okay? And she instructed him when she said whatever benzodiazepine it was, cannot drink alcohol with this medication right here, this benzodiazepine, okay? And so she asked him, the client, do you have any questions about these prescriptions? And the only question he had, red flag for me immediately, was, the only question he had was, which medication was it that I can't where I can't drink while I'm taking it? What's that a clue for? What does that mean? What is that a clue? What red flag is that for you as a nurse? To me, that means he's going to go home and drink. He can't wait to have a drink, and so he wants to know which medication he can't take while he's drinking. Okay? Just a little story there in between. I like to give little stories like that. And the nurse, I don't know, I'm assuming the nurse recognized that, so we talked about that with the student after that experience. Okay? You got to look for those little red flags. Next question. This is the last one. Okay, client is taking chlorodiazepoxide. I'm sorry, I can't pronounce these very well, but I do my best. This is brand name Librium for general anxiety disorder symptoms. In which situation should the nurse recognize that this client is at greatest risk for drug overdose? So your clues are the name of the medication, it's telling you what it's being used for, general anxiety disorder. Your next clue, greatest risk for drug overdose. Okay. All right. Answer choices. Number 1, the client has a knowledge deficit related to the effects of the drug. Number 2, the client combines the drug with alcohol. Number 3, the client takes the drug on an empty stomach. And number 4, the client fails to follow dietary restrictions. Okay, so in this case, this does not tell you in the stem of the question what drug classification this is. So you have to know what's Librium, what's chlordiazepoxide. Tried to learn so hard how to say that. I still haven't. Anyways, I don't know how to say it, but I know what drug class that is. Drug classification, that's a benzodiazepine, okay? It doesn't end in PAM or LAM like all the other ones. Alprazolam, lorazepam, it doesn't end in PAM or LAM, so you have to learn that one separate. It's a benzodiazepine. Used for anxiety, used for a lot of different things, okay? Librium, I've used Librium quite often for the alcohol detox. It's used for benzodiazepine detox also, but it's given on a taper where the patient is tapered off slowly, where they leave the center and they're not taking any benzodiazepine. Okay, so where would the client be at greatest risk for drug overdose? And so we'll give you a minute and come back. Okay, let's come back and talk about this one. There should be some clues in all the previous discussion about this. All right, number 2 is the correct answer. Chlordiazepide or Librium, brand name Librium. Okay, and alcohol are both central nervous system depressants. So the correct answer is number 2. It is dangerous, very dangerous, if the client combines this drug with alcohol. The Librium and alcohol are both central nervous system depressants. When combined, these drugs have an addictive effect. They can also suppress the respiratory system, may lead to respiratory arrest and death. Okay, benzodiazepines, you got to know those. Okay, and so that's it. See you next time. Have a great day.